Hi, thank you for taking the time to look at my poster presentation on promoting integrative medicine. My name is Susan Prather. I'm a family nurse practitioner and integrative medicine practitioner, and I currently own the Way Clinic, which is an integrative medicine clinic. I want to start out by defining integrative medicine and explaining how it uses a whole person, patient centered, and personalized approach that's evidence based. Integrative medicine is a holistic medical discipline which takes into account the lifestyle habits of a patient. It focuses on the relationship between the provider and the patient while taking a healing oriented approach to the patient's care. The whole person, mind, body, spirit, and community is engaged in the healing process. This plan of care takes the least invasive, least costly, natural approach while incorporating evidence based medicine and complementary therapies to help the patient achieve wellness. Integrative medicine takes into account the addition of lifestyle medicine, but does not focus on curing a disease, but instead on health and healing. Integrative medicine incorporates both lifestyle medicine and a medical home model in its approach. Integrative medicine is much more of a wellness based approach, but it does incorporate lifestyle medicine, which includes whole foods, plant based diets, physical activity, optimal sleep, social connection, decreasing toxic substances, and properly managing stress, as well as incorporating a patient centered medical home model, which delivers primary care that's comprehensive, patient centered, coordinated, accessible, and has quality and safety at its core. So, integrative medicine, in my opinion, actually is a better model because it incorporates both of those two modalities. My personal and professional mission, especially through the Way Clinic, is to help patients break away from the traditional sick care model and move towards life and wellness. I really want to be able to empower my patients and support them with the medical care and resources that they need to break free from anything that is keeping them from achieving their health goals. I will treat the root cause of problems rather than just suppressing the symptoms. This is definitely a switch in my thinking, given that I have been a conventional practitioner for more than 11 years at this point. I found that the conventional model did not serve me personally after I became very ill and was unable to really find answers to my own health issues. And as a result, I found an integrative medicine approach, and I was unable to go back to just continuing to treat symptoms and sickness rather than trying to help people move towards life and wellness. It's important as integrative medicine practitioners to have a set of interventions that we go to take care of our patients. And the most important one, in my opinion, is communication. If we do not spend the time that we need to be able to communicate with our patients, and that requires active listening, then we will not get to the root cause of their issues, and we will not be able to formulate a plan that will work for them specifically. So it's important to have some motivational interviewing skills to be able to use the Pearl statements such as partnership, empathy, acknowledgement, respect, legitimation, and support as we go through and ask questions about our patients. Um, and it's also really important that our patients are able to access us. Within my clinic, I utilize technology to help that. My patients have literally 24/7 access to me to be able to ask me any question in regards to their medical care, their lifestyle, their health. If they're in the grocery store and they want to ask a question about a food that they're buying, then they have that access to me. And I know that seems a bit invasive as a provider, but so far, most people have been very kind to me in that they don't ask me to do things on the weekends and after hours that would put an extra burden on me. But at this point, I'm that passionate about my patients being well that I want them to be able to have that access to me. So we definitely utilize that within our clinic. Then there are specific tools and techniques that you can use as well. Of course, BMI is something that we've all heard and used for a long time, but we know that it is not a perfect measurement, but we still do utilize it to help us make some decisions clinically. The body surface index is also a good tool, especially because it does incorporate in the waist circumference, and that helps us to make some decisions about cardiovascular risk that we're not totally able to make with just a BMI alone. I currently use a Tanita, bioelectrical impedance scale in my clinic. That actually gives me very, very detailed information about my patients' weight, their BMI, their body fat percentage, their muscle mass, their body water, their bone mass, and even a metabolic age, which has been very interesting and very motivating for patients. When I have a 30-year-olds come in and their metabolic age is 55, they are very interested in how to change that number. And including exercise as a vital sign, I think, is also very important. It's something that we monitor and ask about at every visit because it is that important. I personally am not a huge exerciser. It's something that I'm having to learn how to do myself, but I know that it's important. And so I am putting in that time and effort because I want to be an example to my patients, and I want them to know that I'm not asking them to do anything that I'm not personally doing. Using diet and activity trackers is also a great way to take care of your patients and really monitor what they're doing from a physical activity perspective and their diet. We use the same app that we use to be able to communicate to do that as well, and that has been great because I can in real time see what my patients are eating and how their activity looks, and I'm able to cheer them on or encourage them if they're not doing so well. And then using that same kind of tracking technology, regular vital signs and biometrics and lab studies can help you with your patient outcomes and just tracking how well they're doing in the process of changing their lifestyle and getting to those root causes of their health problems. It's also important to have personalized plan for patients. So although these self-care, nutrition, and exercise activities that I'm going to mention are all kind of my standard go-to things that I would talk about with every patient, obviously each patient is different, and I have to modify these to fit that particular patient and what is going to work for them from a nutrition perspective that would be sustainable, as well as from an exercise perspective and how they would be able to continue that activity. But I'm going to go through a couple of things that I typically recommend to my patients as a part of just my standard plan. So in regards to self-care, it's very important that they get sleep. I feel like this is one of the biggest issues that we have in our society. We're always on the go and we never get good quality restorative sleep. And there's so many detrimental effects to not getting good quality sleep. And so we talk a lot about that, and at least getting 7 to 8 hours of sleep a night, and how they can do that, things that might be help or maybe keeping them from being able to sleep. And we go over that. Also, stress management techniques. We have a couple of options in our clinic. We use binaural beats as well as cranial electrical stimulation in our clinic as a stress management technique. And we talk about deep breathing and other things. Deep breathing is so important to help support vagal tone, and that is important in our overall health. I even talk to them about journaling at times, especially if they're going through a lot. I look for their social support, and I explain how meaningful exercise can be helpful in a self-care capacity, not just as a way to be healthy. As far as nutrition goes, I always recommend high quality whole foods, to limit refined grains and sugars, to avoid processed foods, to have a high intake of vegetables, to choose organic when they can, when it's financially feasible, to avoid hormones and antibiotics in their meats and dairy, to choose lean meats and low mercury fish, and proper hydration. And this is another area where I feel like people really do not do well. Most of us are not drinking half our body weight in ounces a day, and that is really the recommendation. So I really, really stress that with my patients. As far as exercise, I really try to encourage enjoyable activities and trying to incorporate some sort of movement every day into their lifestyle. Even if it's just 5 or 10 minutes, it's better than nothing at all. And then also just tracking that activity and then planning rewards for themselves when they do well. And then I try to encourage positive self-talk, because for most of us, our thought processes around exercise is usually pretty negative. And so I really try to talk to them about how to be positive, especially when it comes to body image as well. And then we try to set smart goals, things that are specific and measurable and attainable and realistic. for them. It's really, really important, and also time sensitive specifically for them. And then for those who are really busy, I try to incorporate some HIIT exercises because they're able to get that done in a lot less time. And then I like to personalize the benefits of exercise for the patient. For instance, if I'm struggling with sleep issues, explain to them how much exercise can help with sleep. And then also having an advanced decision for specific points of decision. So, in other words, if you have a really long, busy day and you're supposed to do 20 minutes of cardio today, what are you going to do when you don't feel like it? Is there an alternative that you could do in those situations? And so, this is sort of the overview of what I would do to start to personalize a plan. But like I said, it takes really good communication to be able to know exactly what works for a patient. And all of these things that I just mentioned are things that I feel are important for myself as a provider to incorporate in my own life so that I can be an example to my patients. I hope you've enjoyed listening, and thank you.